and there is really no successful therapy. And I think the worst case I ever see, part of my training was at the Sloan Kettering Cancer Center, so we saw a lot. A gentleman who came in and he was coughing up black sputum because he had metastatic melanoma to his lungs. And then another patient who, at the time of autopsy, it looked as if someone had gone over all his organs with a pepper shaker. It had absolutely widespread. So it's a tumor that you want to diagnose early. This early diagnosis will get it out of there and cure it. Second question was about severe cramping. And it's very common in people's feet when they have Parkinson's, especially often at night or after exercise. It's called dystonia. And other parts of the body can do the same thing, but the feet are really the most common. And that can be from too much levodopa. So, if you have taken your levodopa and now it's in 30 minutes after you've taken, oh my God, you get the cramping, then it's probably related to too much. If you wake up in the morning, if 4, 5, 6 o'clock, you find out your feet are cramping like fury at night, it's probably because you're now getting too little. So it can be from too much or too little. So I encourage anyone, and there's so many things in Parkinson's where too much will cause you symptoms and too little will cause you symptoms. So I encourage everyone, when you develop a new symptom, try to figure out relationship between what you're doing, what the time of day is, when you've eaten, and when you've taken your medicines. And it's what we call journaling, right? Maybe take 2 days out of the week, Tuesday and Thursday or something, and just write down everything that goes on in your life. You don't need to put in, odd things like a baseball game or things of that sort, but, write down when you take your medicines and when you eat and such, and what your activity was, to see if there is any correlation between your symptoms and when you take the medications. And that's especially helpful to your doctors. So that's why I encourage everyone to, when you journal, bring that into your physician. Or if you're doing telemedicine, be sure you inform the physician of what you're seeing, if you're seeing any pattern to things, because that really helps greatly in the management of the illness. There are things you can do for it other than the medications. Exercise helps quite a bit. So doing strengthening exercises in the feet and any sort of relaxation therapy also helps. Let me look at my notes here. Deep brain stimulation may help, and Botox, botulinum toxin injections in the area where we're having the cramping, that has also been shown to help. And the third question was finding himself short of breath, short of difficulty taking a deep breath. That could also be a dystonia. So again, I would try to look for any correlation between time of day and activity. And just like the feet, exercise would help that, taking deep breaths, working on that, doing some breath holding, trying to take a deep breath in and hold it as long as you can. That'll help strengthen the muscles in the chest wall and strengthen the muscles in the diaphragm. So thank you, Jose, for the questions. Anyone else?
Has there been any correlation to diet related to something? That's what we're trying to monitor now, like
Right.
if he has a bagel in the morning, is it worse, or if he has oatmeal?
Yeah, there doesn't appear to be any relationship to the diet and short term. I can go over all the things, how diet can affect it, but short term probably not. However, what you eat can if you eat something that's reasonably high in protein, right after or while you have taken your Cinemet, it will bind the Cinemet. And so it'll be less active, levodopa will be less effective. So that's why we always encourage people to take food 30 minutes before you eat, preferably on an empty stomach. Although some of these medicines will cause nausea. So something that's non-protein, a cracker, slice of bread, something of that sort.
30 minutes enough?
30
Because you know how
minutes
the
is enough.
Symptom is slow.
Yeah. And the other thing you should do when you're taking your medicine, I read a very interesting article about posture and taking your medication. It's better to be sitting upright or standing, and it also helps to lean a little bit to the right. And if you think about it, the stomach, as you know, it has a sort of like a big pouch. There's a short end to it and a long end to it, and the long end is to the left and the short end is to the right. And liquids will slipstream down the short side of the stomach and into the duodenum. And so that's why if you lean a little bit to the right, the liquids will get out rapidly. And that's why it's better to do things with taking your medication with reasonable amount of liquid, because that helps just sweep this pill right into the upper part of the small intestine.
You mean walk or something?
Doesn't make much difference. But don't lie down right afterwards. Don't slouch down. Yeah.
Seems like it works a lot better if you exercise. If you take the pill, you're better off exercising. After you take it, you get it going.
I mean, theoretically, if you look at the theory, theoretically that shouldn't, because what you're doing when depending on how much you exercise, is you're actually reducing blood flow to the intestinal tract. Your circulation preferentially sends blood to your muscles and takes it away from the intestinal tract. So theoretically, I'll put that in theory, exercise right after taking the medication shouldn't help with absorption. However, if you find that works, go with it.
Well, it's helped me. I know if I take the pills, I always feel better after I exercise.
Well, of course, exercise is the critical therapy anyway. And if you look at, is there anything that we can do to slow the progression of the disease? And the most important thing is exercise. Our medicines to date have no effect on slowing how the disease progresses. Exercise does have an effect. So, you know, and types of exercise, it really doesn't make any difference. The ones that have been studied are the boxing. We know from some clinical trials that seems to help. We know that cycling, getting on a stationary bicycle and cycling, and especially doing intervals where you go fast for a short period of time, and then you go slow, and then you go fast again, and then go slow, has also been shown to be effective in slowing the progression. But virtually anything else, walking, jogging, marching in place, strength training also helps. Doing things to strengthen the muscles has been shown to help. So any variety of exercise, and of course with the voice, the speech therapy, the Big and Loud, the program of really learning how to project your voice has definitely been shown to slow the progression of that condition. And back to diet. Diet seems to, well, if we go back, what the cause of the illness is, what causes Parkinson's disease? Well, it's something goes on and causes a normal protein and a neuron to misfold. Proteins, when they get formed, have a certain shape, and if they don't have that shape, they have the wrong shape, they don't work. And there's a protein called alpha-synuclein, which is a normal protein in the neurons. Something causes that to misfold and then start accumulating. So it's the misfolding and the accumulation of the alpha-synuclein that causes the disease. It hurts the neuron, neurons can't produce dopamine, and then other neurotransmitters, and that's why you have the disease. This appears to be multifactorial. There's certainly a genetic component. 5 to 10% of people, there's a definite genetic component that runs in the family. If you do the testing, you can find the 3 genes, which we definitely know make you more prone for Parkinson's. However, if you take a family that have those genes, only something like 10% of those with that abnormal gene are the disease. So just the gene alone isn't the whole thing. The other thing is environment. We know that pesticides and herbicides will do this. Paraquat is the classical pesticide. That's why anyone who's a veteran was in Vietnam their Parkinson's is under veteran benefits because of the Agent Orange that they got exposed to in Vietnam. And something about diet has an effect as well. People who eat high-fat diets and eat a lot of milk products are more prone to develop Parkinson's disease. However, I can't blame all milk products, so I'll just leave that there. What happens in diet, and perhaps other things that will affect us are small particles in the air. You know, if you go drive behind a diesel truck, anytime you see this plume of small particles, those have been shown to increase your risk of Parkinson's disease. And some of those occur because they get into the nerves to the sensory part of the nose, which is why so common in Parkinson's, the first thing that happens is you lose your sense of smell. Other ones get into this intestinal tract and change the bacteria, change the what's called the microbiome. That's all the organisms, the trillions of organisms that live in our intestinal tracts. And it's been shown that substantial people with Parkinson's have certain abnormalities in the microbiome that seem to be common among all the people with Parkinson's disease. Absence of some bacteria, presence of other bacteria. And if you take there's a very nice experimental model. There's a mouse that's been genetically altered to actually carry one of the genes that causes Parkinson's disease. And if that mouse is raised in a germ-free environment, it will not develop Parkinson's disease. If it's fed normal food and such, the percentage of them will develop Parkinson's, which will progress normally. If you take stool from people with Parkinson's, feed it to the mice, they develop Parkinson's disease much more rapidly. So there is something in the microbiome that makes people more prone for Parkinson's. And how you treat the how you try to maintain a normal, actually there's a study going on right now on people with Parkinson's where they're putting them on a high fiber, low fat, low milk product diet to see if this has any effect on the progression of their Parkinson's. And the other thing other things that will help in this are if you eat fermented products, so sauerkraut, sourdough bread. If you like Korean food, there's a fermented cabbage preparation called kimchi that will actually change your microbiome back more toward normal. So we encourage high fiber, plenty of fruits and vegetables, especially a colorful diet, red things, green things, orange things, yellow things, and less meat. Dairy products, yogurt has actually been shown to be beneficial because, of course, it has live cultures in it. Now, if you do eat yogurt, you want to be sure that you have a live culture yogurt. So many of them are fully pasteurized, so you can't, if they're made with pasteurized milk, that's one thing, but if they're now pasteurized after the yogurt is developed, it kills off all the healthy bacteria.
Is there any studies done, my wife was a nurse for like 20 years in the operating room, is there any studies showing that could contribute to Parkinson's? Gases or something?
Healthcare providers.
I'm sorry?
I'm just thinking, I'm trying to think healthcare providers, not that I'm aware of. And especially if you're in an operating room, you weren't exposed to a high germ environment. Generally, it's people in rural, it's more common in people from rural areas, more common in people in the culture industry, presumably because of the pesticides and herbicides. But I will research that.
Give you something to do.
I'm going to see if the people in my group of physicians, two to develop Parkinson's disease, which would be about the average for the population.
We're talking about nutrition. You say something about aspiration, like aspiration pneumonia?
Right.
Like,
Yeah, that's, as the disease progresses,
yeah.
well, actually it can be early in the disease or late in the disease, we lose the function of the whole swallowing mechanism becomes impaired. And that's, of course, why the difficulty with speech and loudness of voice and enunciation, but those are the same muscles that take care of swallowing. So that one of the problems in Parkinson's, usually later but can occur earlier, is aspiration. And it's from the weak muscles in the swallowing mechanism not directing the food down into the esophagus but down into the airway. And that's where the speech programs have been shown to reduce the likelihood of aspiration. That's where, even though your voice may be good, you really want to work on one of the speech programs to get the voice stronger and louder, and that reduces the likelihood of aspiration.
What about hallucinations? Is that medication or progression of?
That can be both.
No. We got an exorbitant amount of cats in our house. Hallucinations.
Mm-hmm. Yeah, that could be either one, and again, try to look at the timing.
Dinner,
Yeah,
during dinner when we have cats, the cats are here.
right.
So,
Does it relate to timing of medication at all?
you see the cats. They don't stay in the room, they just go.
Yeah, I mean, that's the classic hallucination, is the
Yeah.
sort of animal crawling off at the side, or the,
Yeah.
you know, something you immediately turn and look and it's not there, or, yeah. And that could be early in the disease. The hallucinations can actually be one of the presenting symptoms, or it can be a symptom later in the disease.
Is that the same as vivid dreams? Like acting out
Vivid dreams are a totally different story. That's a thing called REM sleep behavior disorder. And REM sleep is the part of sleep when we dream. And what happens during REM sleep in quote normal people is you become paralyzed. Every muscle shuts down except for your respiratory muscles, and you can't move. But in Parkinson's, you're not paralyzed. And so as a result of that, in the dreaming phase part of sleep, you get very restless and agitated, you can get up and walk, you can beat up your bed partner, you can shout out things, and that seems to do better with levodopa. Levodopa seems to improve it. That's also where, melatonin has been shown to be helpful, but in low dose. I was just in a pharmacy waiting for something and was browsing through their quote supplement group. And melatonin, their dose started at 5 milligrams. They had 5 milligram and 10 milligram. The recommendation is a starting dose of 3 milligrams. So you want to start low and not go high. But I don't really want to go any higher than 10. They recommend somewhere between 3 and 9 milligrams taken before bedtime. That does seem to help. And the other big critical thing with REM sleep behavior disorder is you want to make the sleeping area as safe as possible. You don't want to have something high, you don't want to, that's where people will fall out of bed when they're thrashing around. So you want to have the bed as low as you possibly can, even mattress on the floor, preferable. And not have sharp objects around, don't have throw rugs, try to avoid the bedside light that you could knock off and shatter, or have something that's reasonably shatterproof.
So your hallucinations, what do you recommend for that?
There's really nothing that works very well, is the problem. And one of the main problems is that the antipsychotics, which are what are really designed for people with hallucinations, really are contraindicated in people with Parkinson's disease. The important thing would be seeing, again, is there any timing related to the medicine that would tell you that, oops, this is too much, or no, it's too little. So if it's when the medication is tailing off, let's say you took your medicine at lunchtime, before lunchtime, and now here it is at separate time you're taking your medicine, but of course you're not absorbing it yet. And that could be at a low peak in the medication.
I apologize, we are late, and you might have already discussed this, but I wanted to ask if you know anything about a laser therapy that I think Johns Hopkins is working on, having to do with ameliorating or slowing down the progress of Parkinson's.
I haven't seen any articles on that. I mean, they're using ultrasound, focused ultrasound.
Yes, yep,
They're using focused radiation,
right.
but I haven't seen anything about focused laser.
Maybe it's that. I just heard about
Right.
it from a friend of mine,
Right.
and that's what she might have meant.
She might have talked about focused ultrasound.
Uh-huh,
I mean, that has been used similar to what Michael Fox had done.
uh-huh,
He had ablation of the certain part of the
right.
brain,
Mhm.
which is why he has this constant his abnormal movements.
Uh-huh.
And this does the same thing. It has been shown to be very helpful in tremor,
Mhm.
and more recently in problems with gait.
Uh-huh.
With people with the shuffling gait and the frequent freezing. That's been the focused ultrasound, which again, that produces permanent damage in a part of the brain. That's been shown to help in both those situations.
Uh-huh. And that's a Johns Hopkins thing that I was gonna look up.
Right.
But my computer died, so it might be interesting to look at it just
Yeah.
to see. Because it's so non-invasive, and it doesn't sound like.
Well, it's going to be invasive. I mean,
It
it
would.
sounds as if you're going to be damaging something. I mean, if you're going to do it with laser or ultrasound or radiation, or you're killing off a part of the brain.
Right, okay. But not with screws and hammers
No,
and.
not with screws, not with holes in your head and
Right.
things of that sort. Yeah.
Thanks.
And the other thing that the focused ultrasound can do is it can punch holes in the membranes around the brain.
Mhm.
So currently, there are a number of studies going on of materials that have been people that were injecting directly into the brain, stem cells, small molecules, a variety of altered genes that are being put directly into the brain to see if that will improve things. And that's where, by punching holes in the membranes, that breaks down what's called the blood-brain barrier,
Right.
which is why a lot of things don't get absorbed in the brain when they get absorbed everything else, because it has to go from the bloodstream into the neurons, and there's this nice membranous barrier that keeps a lot of things from going in the wrong direction. So that's where one of the features of this focused ultrasound may be to break down the blood-brain barrier so these agents can get into the brain more easily.
Does the barrier come back? Does it heal again afterward?
No.
It stays the same? huh?
Well, it's scarred, but it doesn't function. Yeah.
Right, okay. So it is invasive, actually?
Right. Yeah. Other questions?
Sure. Been reading about VSED, voluntary stopping eating and drinking. Can you speak to that, its relationship to Parkinson's? Right now, Kara has quite a bit of dementia, so
Right.
she can't make the decision herself. She doesn't want to eat,
Right.
she doesn't want to drink, but she hasn't made a legal statement that she doesn't want to do that.
Right.
So we're stuck.
Right.
Do you have any other comments on that?
That's a tough one. I mean, you're talking, you're talking about end-of-life
Yeah,
recommendations of things, you know, you're writing down
yeah,
the list of things that you want done and you don't want done. The problem is, and if you are her healthcare proxy, then you can do that. It's when someone that does not have a healthcare proxy, you're allowed to make decisions for someone who is incapable of making those decisions.
I had talked with the nursing home lady and admission, and I
Right.
said, well, if she won't feed herself, will you feed her? And they said they would, but I don't know. If I decide to keep her home instead of nursing home,
Right.
if I stop feeding her or giving her a drink, unless she wants it,
Right.
am I gonna get in trouble? She's losing weight.
Yeah, yeah.
Uh,
That's a very interesting question. And I know exactly how you feel. You know, trying to put myself in your shoes, I would have a difficult time not encouraging eating and drinking.
Right.
I would think what you do is you do the best you can. It doesn't take much to satisfy someone's thirst or hunger.
Right.
You know, what you may end up giving, as you know you're doing, inadequate amounts. That's not your problem. You know, what you do is you try to satisfy as much as you can, but forcing, all that's going to do is increase the risk of aspiration and pneumonia and,
Yeah, it's difficult to get her to eat enough.
yeah,
And drink enough.
that's right.
I try.
And my heart goes out to you because I would, again, putting myself in your shoes, I would try to do what I could to keep her comfortable, recognizing that that's all you can do. Yeah.
Thank you.
You know, certainly as far as decision-making, you know, once you have a healthcare proxy, and the important thing though is that at some point, and I encourage everyone, anyone over the age of 18 should have a healthcare proxy and should have discussed their wishes with the person who is their proxy. What usually happens is we wait too long, and as a result, we get things done to us that we really never wanted. I like to use the example of my mother-in-law, who developed dementia. We had had long discussions with her, and she also had chronic lung disease. We had had long discussions with her before she was demented on if push came to shove, would she want to be on a ventilator, would she want to have cardiopulmonary resuscitation, did, you know, all the list of, and she was adamant, no, no, no. Well, when she was in the nursing home, all of a sudden, I've forgotten what went on, but all of a sudden she, I think, oh, that's right, she suddenly had a cold or upper respiratory infection and had severe difficulty breathing. So she was rushed to the hospital emergency room because we hadn't worked out with the nursing home, but please do not transport to the hospital. And there the doctor said, well, I'm going to intubate you. And she said, you know, he said, you're struggling, you're having trouble breathing, I'm going to intubate you. And she said, okay. At that point, my wife comes through the door and says, Mom, you want them to shove a tube down your throat? She said, no. It was how it had been turned. You know, so that's why I really encourage, all three of my kids have signed healthcare proxies. I'm not their proxy, I don't wish to be. It's often better to have a disinterested third party become your healthcare proxy. And you really should sit down and go through what you wish to. Do you wish to have a feeding tube? Do you wish to be on intravenous feedings? Do you wish to be dialyzed? Do you wish to be on a ventilator? And if you may have an illness that would have a limited period of time before it's relieved, would you be on a ventilator for a couple of days? Or, Yeah, so I think you need to go through all
Okay, I
those
wasn't
details,
sure.
so that you know, it doesn't have to be all written down. Just,
Okay,
it's
so I
only that
thought-
you have discussed that with your proxy, so that the proxy knows what your wishes are. And that gives you, that you then, as the healthcare proxy, you have the absolute say in what's done.
So, don't withhold, offer, but don't force.
Offer, but don't, I wouldn't withhold, I would offer, but,
Don't force.
and you're, in the nursing home, you should say, this is my, as your healthcare proxy, these are her wishes. Yeah.
Is it true if you are taken to the hospital, that they will not really recognize your end of life wishes? If you end up in the hospital?
Right, if you end up in the hospital,
Pardon me? Yes.
basically, the first thing they should be, or at least one of the very earliest things they should be asking is, do you have your healthcare proxy? That's where I recommend the standard emergency medicine approach is that you should always have your healthcare proxy held by a magnet to your refrigerator door, because that's where the EMT, the ambulance crew is going to look to see whether you have one. Because they look at that, that says do no cardiopulmonary resuscitation. They're not going to throw you down on the floor and bring out the paddles and go after you. So, yeah, I mean, and once you're in a hospital, if you're, that's one of the problems if you don't have your healthcare proxy with you. You can say, if you're capable, yes, I have a healthcare proxy and it is so-and-so, my daughter or my son or my lawyer or whatever. Then they should follow that proxy's wishes.
There's another document that could be very helpful, and that's the MOLS, Medical Orders
Yes,
for Life-Saving.
that's really toward the end of life.
Yeah.
Usually it's if you're within the last couple of years of life, that's highly recommended, and it's actually something that your physician should be talking with you about, but I can guarantee you that probably 80% of the time the physician will not bring that up. It's called the MOLS, medical orders, or there's now a POLST, which is physician orders toward the end of life. And that's a more detailed list of what your wishes are. So again, that doesn't depend on the healthcare proxy, but that's another form. And again, if you have some severe disease and you think that I ought to be thinking about what I want done to me if something should happen, then ask your physician, could we please fill out a MOLST form? It's MOLST.